Hello everyone. Now we are going to discuss about paraneoplastic syndrome. So what are paraneoplastic syndrome? Some cancer bearing individuals develops signs and symptoms that cannot readily be explained by anatomic distribution of the tumor or by the elaboration of hormones indigenous to that tissue from which the tumor arose. 10% cancer patient experience PNS. So what is the significance of PNS? Why we need to recognize paraneoplastic syndromes? Because they may be the earliest manifestation of an occult neoplasm. Second, they can cause significant clinical problems. Third, they may mimic a metastatic disease. Now we will discuss about the various paraneoplastic syndromes, their associated cancer, and the mechanism or substance behind the development of these paraneoplastic syndrome. First category is endocrinopathies, one of the most important paraneoplastic syndrome group. In endocrinopathies, first is Cushing syndrome. Cushing syndrome, which is seen with pancreatic cancer, neural tumor and a small cell carcinoma of the lung. ACTH or ACTH-like substance are responsible for the development of Cushing syndrome in these cancer. Syndrome of inappropriate ADH secretion, which is seen in a small cell carcinoma of the lung and intracranial neoplasm. Secretion of ATH and atrial natriuretic hormones is responsible for the development of syndrome of inappropriate ADH secretion. Third group is hypercalcemia, which is seen in breast cancer, adult T-cell leukemia or lymphoma, renal cell carcinoma, squamous cell carcinoma of the lung, and parathyroid hormone related protein PTHRP is responsible for the development of hypercalcemia. Along with PTHRP, TGF alpha, TNF and interleukin 1 also play an important role in development of hypercalcemia. These are the mnemonics that I have made. You can form your own mnemonics. Hypoglycemia, seen in ovarian carcinoma, fibrosarcoma and other mesenchymal sarcomas. Secretion of insulin or insulin-like substance are responsible for the development of hyperglycemia. Polycythemia, seen in renal cell carcinoma, hepatocellular carcinoma and cerebellar hemangioma due to the increased production of erythropoietin. Osteomalacia, seen in phosphaturic mesenchymal tumor due to the secretion of FGF23. Other category of paraneoplastic syndrome is nerve and muscular syndrome. In this, one of the most important paraneoplastic syndrome is myasthenia, which is seen in bronchogenic carcinoma and thymic neoplasm. The mechanism behind the development of myasthenia is immunogenic. The other group is disorders of central and peripheral nervous system, seen in breast carcinoma. Third category of paraneoplastic syndrome is dermatologic disorders. In dermatologic disorders, first is acanthosis nigricans, which is seen in the cases of gastric carcinoma are in patient of lung cancer and uterine carcinoma. Mechanism behind the development of acanthosis nigricans is immunologic, secretion of some epidermal growth factors. Dermatomyositis, which is seen in bronchogenic carcinoma and breast carcinoma. Mechanism is immunologic. Fourth category of paraneoplastic syndrome is bone and soft tissue disorders like hypertrophy, osteoarthropathy, clubbing of finger, which is seen in bronchogenic carcinoma and thymic neoplasm. Mechanism is unknown. Next category is vascular and hematological changes. Venous thrombosis is seen in bronchogenic carcinoma, pancreatic carcinoma, and some other cancer. And this is known as Trochu phenomena. Venous thrombosis in bronchogenic carcinoma, pancreatic carcinoma. This is because of the tumor products that activate the clotting inside the veins. DIC, disseminated intravascular coagulation, which is seen in APML, acute promyelocytic leukemia, and prostatic carcinoma. This is also due to the tumor product that activate the clotting system. Non-bacterial thrombotic endocarditis, which is seen in some advanced cancer due to the hypercoagulability. Red cell aplasia, noted in thymic neoplasm. The mechanism is unknown. And in last category of paraneoplastic syndrome, there is some cancer may develop in nephrotic syndrome due to tumor antigen and immune complexes. Cushing syndrome is the most common endocrinopathy and most common paraneoplastic syndrome is hypercalcemia. Thank you.